Hi, my name is Jazz. If you are new to my channel, you will find videos of me sharing my experiences through my journey of breast cancer. I am hoping that the videos will help anybody that is going through something similar to me, or perhaps anyone that knows someone who is going through something similar to me. I am today sharing with you information, my experience through breast cancer surgery.
So I have come out of surgery. It has been a good 4 to 5 hours and I feel that I'm doing okay. I've got some aches and pains in my arm and my shoulder, but they're not too bad. I feel like they're manageable. I am going to be staying in hospital overnight, but that could possibly be because I was one of the last patients to have their operation done. But yeah, I honestly can't feel the pain from the cut under my boob or under my arm, so that's a good sign. I think I'm just aching generally from the way that they had to put my arm in order to do the operation. So yeah, all in all, everything went well from as far as I'm aware. I haven't seen the surgeons as yet, so I hope I will see them tomorrow to understand what the procedure entailed. But yeah, I'm doing okay. I'm having a bit of a hot flush at the moment, but yeah, all good. Hopefully probably take a few painkillers before I go to sleep. But yeah, thank you again for everybody's support. I didn't really tell many people the date of my surgery because the more I spoke about my surgery and what it entailed, the more I got anxious. So yeah, I have messaged obviously a few people since my surgery just to let them know I'm okay. And yeah, people have been surprised that I didn't tell them, but I do apologize. I'm so sorry I didn't tell you in advance. But I had to be selfish and think about me and what I could manage before the surgery. But all went well, so yeah, I will let you know as soon as I can do my next recording as to how I'm getting on after surgery. I have got plasters over the areas where they have done the cuts, and I also have a drain to drain the liquid from the surgery and my lymph nodes. So I think that will be there for at least 10 days to 2 weeks, but I'll keep you posted.
It's now been 2 weeks since my surgery date. I left hospital the day after my surgery, so they let me leave with some surgical socks so I do not get deep vein thrombosis, DVT. So that was a bit of a struggle to wear those, as they advised that I need to keep them on for at least 2 weeks. So I kept calling them my sexy socks. So yeah, they were a bit of a pain to wear because I never wear socks to bed. But obviously they are there for a reason to, you know, prevent me from getting anything in my legs. So other than that, they also sent me home with some bottles for the drain. So there was still some fluid and some blood that was coming out of my body after the surgery, so the drain was there to collect that fluid, and I had to monitor that fluid every day to see how much was coming out every day. And I would have to call the breast care nurses to advise them of the amount that was coming out every day. And then once it got to a certain amount, once it was getting less and less, which I was really grateful it was getting less and less, they then asked me to come in and they removed the drain. So it was about 12 days after my surgery that they removed the drain. But oh my god, there were times I forgot I had that drain in, and I would literally be dragging it around on the floor, and the kittens would chase it, and the kittens would bite at the tube basically, and I'd have to like push them off. So that was not fun and games. But yes, I had to keep my dressing gown on pretty much most of the time because it had a really convenient pocket where I could keep the drain bottle in, so that was really helpful. But yeah, so happy that the drain was out, because I don't think I could cope with it any longer. So whilst I was in the hospital, a physiotherapist came to see me, and she gave me some exercises to do to keep my arm moving. And it's really important to keep it moving, because you don't want it to get stiff, and you want to be able to gather as much movement as possible, ready for when you have radiotherapy. So it's been 2 weeks since I've been doing these exercises, and they are somewhat painful. They've given me plenty of paracetamol to reduce the pain, but I am at the moment, so if I lift my arm, so this is the arm I've had the surgery. If I lift my arms, I can move this one all the way up, and I can't move this one up. It really hurts, really hurts. So after the surgery, I've had a lot of numbness. I couldn't feel my arm very much, and I've had a bit of swelling. Not too much that it would be of concern, but the nurses asked me to monitor it and just keep reporting on it. But what they basically keep telling me to do is moisturize it and keep massaging it to encourage the feel in the vein, in the nerves, etc. Because obviously they removed quite a lot of tissue when they did the surgery. So my surgeon basically told me that she removed 17 lymph nodes from underneath my arm. So that is what they call an axillary lymph node clearance. They remove all of the lymph nodes because they don't want to take the risk of, the cancer, being spread any further, or it being anywhere where they've not been able to see it because it's that microscopic. So I knew I had to have it done, but it obviously is upsetting as well at the same time. I have taken some pictures of what I currently look like with my scars, etc. So I will add them onto the video. But it has caused me a little bit of pain. There's a lot of things I can do and can't do. The day of when they released me from the hospital, they gave me a bra which was front fastening, so it was easier for me to put my bra on. And since then I have obviously had to change my bra. I bought some post-surgical bras from Marks and Spencer's, and they've been fabulous. They're so soft and so comfortable, and they don't irritate that area where I've had the surgery. I have had to sleep with them on because I am really worried that I'm going to obviously knock it or tear it or something. But yeah, obviously that fear is there, and I've not been able to sleep on that side of my body because of that. It's been hard to sleep at night because I'm very conscious. I don't want to, hurt myself further, or even when I had the drain, I was really scared I was going to pull the drain out. So now that I've had the drain out, I'm still not able to sleep on that side of my body. So fingers crossed, day by day, I am getting stronger. I'm getting more movement and a bit more flexibility in the arm. And I can't wait to sleep on that side because I'm really missing it, and hopefully then I can get a proper full night's sleep. I'm really looking forward to it. So yeah, today I have a telephone consultation with my oncologist, and I will also find out some results from what the tissue looked like after they had done the surgery. I'm hoping that the chemotherapy did what it was supposed to do. So as soon as I have had that communication, I will then update you guys to let you know where I'm at. I'm hoping and praying for good news. I can only say thank you to everybody as well that has been so supportive and who has been praying for a positive outcome for me as well. So I will keep you posted as soon as I know more. It's been about 11 weeks since my last chemotherapy session, and it's been about 6 weeks since my surgery. Since then, I have had some appointments with my breast surgeon and also with my oncologist. They have shared with me the results from my surgery, from the tissue which they removed from my breast, and also from the lymph nodes which they removed from under my arm, where the cancer had actually spread to. So it's been a little bit difficult for me to accept and acknowledge the results, but it is good news. The chemotherapy did what it was set out to do. From the test results, they could not see any cancerous cells within the tissue and lymph nodes that they removed. So thank you so much to everybody for all your support, your kind words, your encouragement, all the prayers. I cannot be grateful enough to everybody that has supported me along through this journey. It's been a really long, hard journey, but I am really grateful to be in the position that I am in today. I'm really grateful for all the medicine, the research, all the support from NHS. It's been absolutely amazing that, you know, everybody has brought me to where I am now. I've still got a long journey to go. I found out from my oncologist that I am going to need 19 sessions of radiotherapy. So that should be due to start within the next few weeks. And I'm also continuing to have via IV 2 different drugs that were given to me during chemotherapy, which I will be having ongoing for about a year, every 3 weeks. So that's, you know, it's just to ensure that the cancer doesn't spread anymore. It's a long journey still ahead of me, but I'm going to keep going, keep fighting. I want to be rid of it all. I want to make sure it doesn't come back. So I'm going to leave on this note and say thank you again to everybody for all your prayers, all your encouragement, all your love and support. Trust me, everybody has given me so much strength that I can't be grateful enough. Thank you so much. Thank you for following my journey.